Hey there, and welcome. So, you're the one tasked with filling out the Institutional Human Resource Data Collection form for your PDHS office? Well, you've come to the right place. We are going to break down this entire process, step by step, to make it as simple and clear as it can possibly be. So, here's our game plan for this little guide. We'll kick things off with the why and who behind this whole form. Then, we'll cover some absolutely essential ground rules. After that, we'll dive right into the nitty-gritty of entering data for your main office and any special units you manage. And finally, we'll wrap up with the last crucial steps: reviewing, submitting, and, really importantly, where to find help if you need it. All right, first things first, before we even touch a single data field, let's talk about the big picture. Understanding why this form is so important and who it's for is really the key to getting it right. Now, I want you to remember that this is so much more than just filling out a form. The data you're about to provide, it's literally the foundation for massive decisions being made at the Ministry of Health. Think about it. Your accurate numbers can directly lead to better workforce planning and resource allocation. Your work here really, truly matters for the future of our national health workforce. Okay, so who exactly should be watching this? Well, this guide is tailor-made for the Medical Officer of Planning at each of the 9 Provincial Directorates of Health Services. So if that's you, you are in exactly the right place. So, we've got the why down. Now for the how. These next few points are what I like to call the essential ground rules. Getting these right from the very beginning is going to save you a ton of time and make sure your data is spot on. These 4 rules are absolutely crucial. First, every single number you enter for staff in position has to be as of one specific date, June 30th, 2025. This gives us a consistent snapshot across the entire country. Second, see that little asterisk? That means the field is mandatory. You can't skip it. Third, whole numbers only. No decimals, no fractions, just simple numbers. And finally, and this one's a biggie, if a position is empty, you have to enter a 0. Don't just leave it blank. A blank space is ambiguous, but a 0 tells us for a fact that the number is 0. Okay, purpose? Check. Rules? Check. Now we get to the heart of it, actually plugging in the staffing data for your main PDHS office. For every single staff category you see, you're going to be filling out a few different columns. Let's walk through this together column by column so there's absolutely no confusion. Here it is, the core of your task. For each staff type, you'll start with the last approved cadre. That's the official number of positions you're supposed to have. Then, you'll put the number of people in position on that key date. Next up is the cadre requirement as per norms, which is how many staff you should have based on official standards. Then you've got the justification column. This is your space to explain any gaps or excesses. And finally, you'll list any staff on no pay leave. Just be sure to exclude maternity leave. Okay, that seems straightforward enough for the main office, but I can already hear you asking, wait a minute, what about that provincial training school I manage, or that special health campaign office? That is a fantastic question, and the form has a really neat way of handling it. And that's a perfect lead-in to our next section. This is where we cover how to report on all those other special units, campaign offices, training centers, anything that falls directly under your PDHS office's management. And you'll be happy to hear the process is surprisingly simple. For every separate unit you need to add, you just scroll to the end of the section in the form and click that little plus button. Boom! It'll generate a brand new, clean section for you to enter that unit-specific data. Easy, right? And the best part? There are no new rules to learn here. The information you need is exactly the same as what you just did for the main office. You'll just enter the unit's name and then fill out all those same familiar columns: approved cadre, in position, requirement, justification, and no pay leave. See? You're already an expert at this part. We are on the home stretch now. You've entered all your data for the main office. You've added your special units. This final section is all about making sure your hard work gets checked, submitted correctly, and knowing exactly where to turn if you get stuck. Now, this next step might just be the most important one of all. Pause. Before you even think about submitting, just take a moment and review everything. Double-check all those mandatory fields, make sure every special unit is accounted for, and just give the numbers a quick once-over. A few minutes of review now can save you a whole lot of headaches later. Let's talk about the platform itself, Kobo Toolbox. It has some really great features that should give you some peace of mind. First, your work is automatically saved right there in your browser. And when you're online, it uploads your saved records every 5 minutes. You can also just click the upload button to force it. The most important thing to remember, though, is that final official submission should only happen after the data has been verified and approved by the PDHS. And look, if you get stuck or just have a question, please remember you are not on your own with this. Help is just a phone call away. Here's a list of senior registrars in medical administration who are ready to help. Seriously, don't hesitate to reach out if you need clarification on anything at all. And just like that, you are ready to go. Remember, the data you're so carefully putting together is incredibly valuable. It's what powers our national health planning and helps us build a stronger, more responsive health system for everyone. Thank you so much for your crucial contribution to this incredibly important work.